pH is direct relationship with the bicarbonate. If bicarbonate decrease, pH will decrease. If bicarbonate increase, pH will increase. Okay, let me simplify another way too, because it is given in the okay, by covering that, okay, we will have a better concept. Okay, so let me cover pH is direct with bicarbonate. And pH is decrease, there are two main points. Either bicarbonate will decrease or H positive will increase. This is I said. H positive is like I said. So when the H positive is increasing, pH will decrease. Okay, remember in this way. No doubt, bicarbonate will decrease because how? Let me cover that. With bicarbonate, I'm adding one H positive. I'm adding one H positive. What will happen? Okay, that will be formed as 2CO3, carbonic acid, and that will be split up into carbon dioxide and water. And guys, by adding H positive, actually your bicarbonate is used up. Level of bicarbonate will be decreased. Okay, so that is a concept. Just I'm simplifying here. Okay, in metabolic acidosis, when the pH is decreased, either bicarbonate is decreased or as phosphor increase. Okay, we will cover that topic in the in gaps. Okay, let's go toward that. Okay, what do you mean by gap? First of all, see the gap. Gap means difference. Okay, for example, I will say, okay, the common word. Okay, we are having gap between them. Means at a different between like this. So normally we, from the chemistry point of view, we normally think that positive ions are equal to negative ions. I mean, if we are both equal, there are no difference. I will say there's no gap between us in a simple, okay, way. But if there's a gap, if there are different, so what's happening here in nine gap? Actually, when you measure the sodium ion, okay, and then if we combine the negative ion, you combine chloride plus another negative ion, okay, that is negative ion. Okay. So here you are taking these are two negative ions, that is positive ion. Here I'm just taking the using no balance. In this side I'm taking negative ion, and in this side I am taking the positive ion. So what's happening here? Actually, when you took the sodium and then you make difference from chloride plus bicarbonate, what's happening here? Actually, positive ions are more than the negative ion. What is the reason? Actually, if you add like that for a positive ion, okay, then there will be no difference, then there will be no gap. If you took chloride plus bicarbonate plus took some, okay, unmeasured, you took some unmeasured like anions, like for example took albumin that have negative charge, some protein have negative charge. If you combine all those, right, one negative ion, okay, bicarbonate one, if you took all other unmeasured negative ions like albumin, protein, if you combine them, then there will be no gap. But that is not case. We normally don't measure these negative ions. So that's why you are having ion gap, because there are certain anions that are causing the gap. So that term they use in ion gap. Why they use that in ion gap term? Because there are certain unmeasured ions present that are causing the difference between the positive ion and the negative ion. Normally there should be both positive ion, negative ion, but we measured the positive ion, okay, and there are certain negative ions that are not measured. So level will be like that. These are the negative ions, okay, these are positive ions. So there is an ion gap present. How much it is from 8 to 12? Okay, so if the ion gap is present, okay, let me raise all of them. Okay, if the ion gap is present, okay, that will be high ion gap. Let me give you another example. Okay, there is another thing in which ion gap is decreased. Okay, normal ion gap, high ion gap, and decrease in ion gap. In two disorders, there will be actually I'm just mentioning one because that's high yield, not high yield, just important. Okay, in multiple myeloma. In multiple myeloma, anion gap will be decreased. Otherwise, we will study high anion gap, normal anion gap. Guys, you will remember, okay, anion gap will increase normal, but decrease in multiple myeloma. That's it. Let's move to the book. Okay, high anion gap. You can clearly see that, okay, it will occur in those disorders. Mnemonic is given on the U word, in other way, mud piles, but here is the mnemonic is given gold mark. Okay, So let me summarize you. If you, for example, if you just, okay, there's no mnemonic in your mind, a question is given, high nine gap. Okay, so guys, let me remind you important point. High nine gap is present in those disorders in which S positive is released. S positive is released. Okay, mean some acid, if you are taking some acid either exogenously, means you have took some alcohols, you have took some, okay, something that is causing increased level of H positive, or endogenously, some like uremia, diabetes, or are producing some acid endogenously. Okay, in one way, in one word, I will say H positive is increasing in this case. And in normal line gap, okay, bicarbonate is lost, bicarbonate is lost. Okay. Okay, there are two different disorders. Normal line gap, other is increase in line gap. Increase in line gap, in one word I will say there are certain disorders in which either exogenously, either endogenously, there is production of aspartate that is causing increase in line gap. Other one, normal line gap, I will just one word, bicarbonate is lost from your body. Okay, that will cause normal line gap. Let's start with high line gap. Okay, here you can see certain alcohol. Okay, ethylene glycol, propylene glycol. Okay, also there's lactate. Okay, lactate will cause the high line gap. Okay, methanol. So in one word, I will say alcohol. Okay, by alcohol, I am covering ethylene, propylene, methanol. So these two points are covered by alcohol. Okay, then next is the lactate. Okay, lactate is causing lactic acidosis. Actually, examiner will not tell you you are having lactic acidosis. There is certain a pathology will be given like cardiopulmonary arrest. Not cardiopulmonary, I will just say cardiac arrest. In cardiac arrest, there will increase level of lactate. Or you can also simplify when there is hypoxemia, decreased level of oxygen in the blood, lactate production will increase. Also, certain drugs can cause lactic acidosis. Leave that, like most common one is a metformin can cause lactic acidosis. Okay, leave that. Next is the aspirin. Okay, okay. Next is the renal failure and diabetic ketoacidosis. So multiple monitor is awesome. Okay, there are certain missed points, but given in the U word, not covered here. So that is the INH, iron, iron. Okay, ferrous iron can also cause high iron gap metabolic acidosis. Remember that. Okay, so we have covered that. Okay, next is the normal line gap. In normal line gap, okay, you will the classic example. Okay, let me summarize the most important example regarding it. Let me cover that. The ketones are important. Okay, renal failure is important. Okay, then is the you can say lactic acidosis is important. These three examples are high yield. Okay, remember that. Next, I'm moving to a normal line gap. How a line gap is normal? That is important point. When the bicarbonate is lost, that is a negative ion. Body try to retain chloride ion. Body retain chloride ion. When one negative ion is going, you are retaining one negative ion. When one body, somebody is leaving you, adopt another body. It's like that. One negative ion is losing from your body, either from gut, either from renal. Remember in this way, bicarbonate is all losing either from your gut, either from your renal system. Or you can say a renal, extra renal. Then what is trying to retain chloride? So that maintain the ion gap. Okay, so guys, what is the most common example is a diarrhea. Diarrhea is hygiene. Okay, remember, diarrhea is hygiene. Okay, next important is the renal acidosis. Okay, and next is saline infusion. These three examples are high yield for normal line gap. Okay, guys, you will remember in diarrhea, okay, you will have normal line gap, metabolic acidosis, in vomiting you will have metabolic alkalosis. So in upper GI loss, you will have alkalosis, in lower GI loss, you will have acidosis. So remember, these both are high yield. Vomiting is high yield, this is high yield. Okay, again, I'm repeating, in lower GI losses, like in diarrhea, you will have metabolic acidosis, this time normal and gas. In upper GI losses, like vomiting, you will have alkalosis. Okay, so we have covered diarrhea. Okay, also in renal tubular acidosis, actually there are certain disorders, okay, in which you will lose the bicarbonate, okay, that will cause acidosis. Actually, in renal tubular acidosis, you are losing bicarbonate, okay, that will cause the actually that will cause metabolic acidosis. And last one is saline infusion. What is happening in saline infusion? Actually, you are giving more chloride, you are giving more normal, you are giving sodium chloride. So here I have drawn multiple chloride. So when there is more chloride, there is hyperchloremia in the blood, chloride will go into the cell. Okay, chloride will go into the cell. bicarbonate will go out. When bicarbonate will go out, okay, normally bicarbonate is present in the cell. When chloride is high, we have given multiple normal saline fluids. Okay, chloride will go into the cell, bicarbonate have come out of the cell. Now, what will happen? This bicarbonate, okay, will come in the plasma, it will be lost to the urine. It will be lost to renal system. Because when bicarbonate is in the cell, it is safe, it is protected, and it come out, it is kicked out. Okay, so that's how. Then is Addison disease. Okay, in Addison disease, okay, you will have loss of bicarbonate. Okay, also there are certain drugs like acetazolamide, spironol. Acetazolamide, actually, normally there is carbonic anhydrase we will discuss in renal system. Okay, and the act on the proximal convoluted tubule, act in absorption of bicarbonate. When you block that enzyme, bicarbonate will loss in the urine. So these are all causes of normal anemia. I hope so. I have conveyed the concept.